A hearty good afternoon and welcome to a session on when to undergo IUI, IVF, or ICSI. We are glad to have Dr. Ramya Mishra among us today to help us understand this topic. There are a variety of procedures within assisted reproductive technology, and a good amount of people are familiar with the terms like IUI, IVF, ICSI, and more. But what do each of these mean, and what are the situations where they are ideal? Let's have a conversation today with Dr. Ramya and try to understand more about these terms and how can it help in our fertility. So today we are going to have an interactive session, and we also want our audience to put out questions that you have regarding these topics to help in fertility. Doctor, can you tell us something more about this?
Yes. Thank you, Sean. Thank you so much. I'm glad that we are once again on this platform to discuss the important topics regarding the patients of infertility and IUI, IVF being the most common amongst them. So, first of all, before we start this interactive session, I would give you a brief introduction of what actually IUI or intrauterine insemination is. See, IUI or intrauterine insemination basically is an ART procedure wherein we first of all check the female for all the parameters of fertility, like her ovulation check, her tubal testing, her uterine lining or endometrial preparations. Everything is checked, and the husband is also checked for the same, for the semen parameters and all. Once we find all the parameters from the female side are okay, then we proceed for this procedure wherein the husband's sperm sample is taken and it is injected directly into the uterine cavity of the female near the fundal area, where it becomes easier for the sperm to go and fertilize the egg at the right place. So this is basically to help those couples where they are finding it difficult to get a pregnancy within the trial period, as we assume like 1 to 2 years for a normal couple. So if after that they are not able to conceive, so we, after checking all the parameters, we advise them to go for this procedure. It is basically a fertility enhancing procedure wherein the chances of getting a conception are increased. So I think we have some questions pouring in or not till now. Before we
Doctor,
get
we
any
don't have.
questions from the audience, I would like to proceed to the other part of the session, which is IVF or in vitro fertilization. IVF is also, science or technology of helping the couples, those who are not able to conceive naturally or by the process of IUI, wherein the egg of the female is taken and the sperm of the husband is taken, and they are subjected to certain, culture conditions, wherein the fertilization happens outside the female body. So we call it in vitro fertilization or IVF process. After that, the embryos are formed in the labs, and these embryos are transferred into the female womb at the right time after the preparation of the uterine lining and everything. But in some cases, we find that this process becomes difficult to happen even in IVF, because the sperm motility or the quantity or the quality of the sperm is not good enough to go and fertilize the female egg. In that case, we subject them to another higher technique, which we call as ICSI, intracytoplasmic sperm injection. In this process, we take the female egg from the body, like we do for normal IVF procedure. We take the eggs out from the female body, and these eggs are subjected to the they're injected with the sperm from the husband by using special techniques and pipettes. We call them as holding pipette, and we call them as injecting pipettes, wherein the sperms are the sperms are taken, the motile sperms are taken, and they are directly injected into the female egg. So this process helps those couples wherein the sperm parameters are not adequate even for IUI or for IVF process. So they are subjected to this one, wherein the chances of getting the fertilization is high, is increased. So they can be benefited from the parents, the couples who want to become parents, whose sperm number is very less or whose sperm motility is very less. They can also be benefited from this procedure called ICSI.
So, Doctor, there's one question. Sorry, there's one question from the audience. I will be putting it up on the screen. What are the tests needed before an IUI?
Okay. See, before Hayakriti, before we ask a patient to go for the process of IUI, we ask the couple to undergo some basic testing. Like in the female case, we go for normal blood testing, like either their complete blood count, their thyroid levels, their prolactin levels, or the viral markers they are checked. After we check them, we give them some medicines or some ovulogents or some medications which help their eggs to start forming. So they are given these tablets. They take these tablets. In some cases we can also ask them to take some injectables or some injections which help the egg to start forming. They are then asked to come for an ultrasound, which we call as follicle monitoring, which starts from a certain day of the cycle, and we serially monitor the growth of the egg in these cases. Once the egg approaches a particular size, then these patients are asked to come. They're given a special trigger shot, and after that, when this trigger shot is given, we subject them to go for IUI after 34 to 36 hours. So on the day of IUI or intrauterine insemination, the husband is asked to give a semen sample. The sperm sample is washed. After washing the sample, under some people go do it without ultrasound guided, and some can go with the ultrasound guided thing also. You can go and inject the semen parameters, semen sample into the uterine cavity. Before this process is done, we always want the wife to undergo the testing of the tubes, whether the tubes are open or not. So in though we want at least one of the tubes to be open so that the IUI procedure can be performed. If both the tubes are blocked, you cannot definitely not proceed for the process of IUI in these cases. The husband also needs to go these basic testing. So the basic blood testing, the viral markers, and the tubal testing are the tests which are required before we go for an IUI procedure. Akriti is another as what is IUI? Why is it done? Okay. Akriti, like in the beginning of this session, I already told what an IUI is. IUI is intrauterine insemination, which I just informed. I just told you that we just observe the eggs, the growing eggs. Eggs are growing or not properly with the help of ultrasound, and then the sperm sample is washed and this is put into the uterine cavity. We call this process IUI or intrauterine insemination. Why is it done? Because it is specially done for those cases where in the sperm the count is not that adequate. We need at least 15 million counts for the sperms to be there, and after washing they may go up to 5 million also. So if the sperm parameter is somewhere between 5 to 15 millions, you can ask the couple to go for the process of IUI. We have many questions here. Dimple has asked a question. I have blocked fallopian tubes. Can I take IUI treatment? Dimple, I just now answered this question, that for anyone to get pregnant, it is very important for the fallopian tubes to be patent or to be functional. Okay, so if your tubes are blocked, then obviously, scientifically speaking, it is very difficult for the patient to conceive. But yes, if the tubes are blocked and the blockage is very flimsy, then yes, they can. There is definitely a chance of getting IUI done, but the success goes down as we see the tubal blockage advances, and we have a hydrosalpinx. Like in the previous session also, we just threw some light on the same topic of the blocked fallopian tubes. So if you are more prone to get pregnancy at an ectopic position. Sean, you must have heard many patients asking these questions to us. What is an ectopic pregnancy? So these are the cases where we find that the blocked fallopian tube patients, they have chances of getting an ectopic pregnancy. So you can try, if you can try in the subsequent cycle wherein your HSG or your SSG procedure is done, where the blockage is just opened and you have a chance of getting pregnant. But if the blockage is strong and the adhesions are very much there, and there's things are there, fibrosis there in the tubes, then it is difficult to conceive with blocked fallopian tubes. You have to go for the higher steps, which we call IVF or IUI in these cases.
So, doctor, we have one more question. How many times IUI can be tried and what age can be tried?
This is a very important question. I have seen many patients coming to me with a history of getting 10 to 12 IUIs done in their lives. So, as per the books are recommended, we should go for IUI 3 to 6 cycles is more than sufficient for a couple to, because it's a monitored cycle. It's a monitored cycle. If everything is functioning normally, then a couple should conceive in 3 to 4 cycles. Still, we give a trial of 3 to 6 cycles, but it is very important to understand that the age parameter is very important as far as IUI is concerned. So till the age of 35, the chances are good. If you have good chances, if everything is fine, your ovulation is fine, your eggs are okay, your AMH is fine, your tubes are open, functioning, uterus is good, and you are trying for IUI, yes, the chances are good. But anyways, the success rates goes up to somewhere around 10 to 12% or at the max 15%, which is slightly variable. But as the age of the female increases, like more than 35 or approaching 40s, they have lesser chances of getting a successful IUI conception, because there the question of their decreased egg reserve also comes into picture. So that is very important to decide whether you are a candidate who is fitting into the category of going for an IUI. You have to first, examine the patient as in toto. Not only that we want to go for IUI. A patient comes to me, many patients come to me also and say, with an MH of zero point 0.4 or zero point 0.5, I want to go for an IUI. I always say, see, your eggs are very, very precious. You cannot, because the success rates of going for a successful IUI cycle is only 10 to 12%. So we should not be, using those eggs with the lesser success rates, options available. So we have more success, getting chances of getting a successful pregnancy, there are more in cases of IVF as compared to IUI. So in that case, definitely you are not a right candidate for IUI. You have to go for an IVF process in that case.
So, doctor, that is also one of the questions from the audience. What is the difference between the IUI and the IVF or in vitro fertilization?
Okay. See, IUI, like I told you, this is a natural process almost, wherein we just monitor the patient. We just do all the tests and we monitor the patient with the help of ultrasound and some tests that things are happening nicely and the egg is growing and everything is fine. And we just put the sperms into the uterus instead of into the vaginal area, which happens naturally. So we just put them in the uterus. So that way the IUI works. Okay, the egg will come at its place, the sperm will go and fertilize it. So the fertilization happens in the female body. So this is almost a natural process. But in case of IVF, it is quite a different one, wherein you ask the patient to get some injections, some injectables are given to her. We make the eggs to grow in size. We take the eggs out of the body. We don't let them rupture in the human female body. We take the eggs out of the body, and these eggs are subjected to the process of IVF, and the fertilization happens in the laboratory. So this is a totally different process, wherein the fertilization happens outside the body, and these embryos are put in the uterus when the uterus is prepared. So they are completely different. IUI is something which is very near to natural things, and IVF is something which we do, and we create the environment for the embryo to grow outside the uterine body, and then we put it back into the human body. This way.
Understood, doctor. So IVF is a little bit more on the lines of helping the embryo develop first in
Yeah.
outside the body and then implanting it within.
Yes, yes, yes,
Understood.
yes, yes. If your tubes are blocked, then yes, you cannot go for IUI. You have to go for IVF in that case, like I answered the previous person also.
So, doctor,
Uh,
also addition to this, there's another one that what is ICSI? But before that, I feel like ideally we should answer this question: what to do if the IVF fails?
See, what to do if IVF fails. Now, once a patient who comes to us and we have a history that he has got or she has got, the couple has got a failed IVF 3 times or 4 times, then we have to completely examine them. We have to examine them from all the parameters which could be the reason for their IVF getting failed. So right from the ovarian factors, from the female factors, we see the ovaries, what is the reserve of the ovaries, what is the position of the ovaries, how many eggs she is having, and what is her age. These are the few very important criteria which we have to look into. Then we will go to the adnexal area or the tubal area, wherein we'll check if there is any tubal factor which is there, I mean any hydrosalpinx, or if it is available, or any other factor, because this can also impact the implantation. Presence of hydrosalpinx, like I told in the previous sessions also, presence of hydrosalpinx decreases your chance of getting a successful pregnancy 50% of the times. So you have to check for any unidentified hydrosalpinx into the tubes. You have to go examine the uterus for any adenomyosis or swelling of the uterus, any fibroids, any polyps, how is the endometrial thickness, that is to be assessed along with the male parameters like how is the semen quality, the motility, the morphology. When we check all these parameters, sometimes we also, and we find nothing, we find all the parameters are absolutely doing good. Maybe if one or two of them are not working fine, but then we have some other things also in mind, like we have to go from the angle of immunological thing. Sometimes the immune system of the female may also reject the implantation of the embryo. So if a repeated IVF fails, patients comes to us, we have to check from all the points, rectify all of them, offer them the most effective way of getting the process done in the next subsequent cycles. We can ask them to go for PGT testing also, that is the biopsy of the embryo, for which in which the embryo is checked for any kind of abnormality, abnormal chromosomes in them. So all this can be done to give them a better outcome next time.
Understood, doctor. Uh, this is actually it's a
We have
very
some more.
important topic, and I feel like there is a lot of answers and a lot of questions also coming about because we have this.
Yeah.
Let's have one more. Uh, what is ICSI and how is it done?
I just now answered this question sometime back. Some other person has also asked the same question. ICSI is intracytoplasmic sperm injection. Okay, that means those patients wherein the sperm motility is not good or the count is not good. We check them into the microscope, the inverted microscopes, the high powered microscopes, the best ones, the ones who are moving with the good motility and they have got good morphology, they are picked up and they are directly injected into the female egg. And this all is done under a very good very high powered microscope. So it's a very delicate procedure, and this procedure is a breakthrough in the field of IVF for those couples where the semen parameters are not good. The egg is taken and it is made stabilized with the help of a micropipette, and the sperms are injected into the into the egg of the female. After checking them properly, this is how this is a very process which is high end, done in the laboratories. So this, I think, this is the one which can help the one with lower parameters of semen.
Perfect, doctor. Makes sense. And I think there's another question that is similar to this. So let's have that as well. Uh, my husband has no sperm. Can I conceive naturally, or what treatment is best for me?
See, those patients where the husband is, the report says that there is no sperm. First of all, we have to check whether there is formation of the sperm or not into the male body. Okay, so we call that whether it is obstructive azoospermia or it's non-obstructive azoospermia. If it is a non-obstructive azoospermia, that means there is formation. There is no formation is happening in the male body only. So if there is no formation, then obviously we cannot help them out. They have to go for the process of IVF, and in that case, donor sperms will be used. So they have to go for donor sperms. But if the patient, we get some of the tests done, and we find that the semen, the hormonal levels are fine in the husband, then we can subject them to a process called TZ, wherein directly sperms are taken out from the male testicles, and if the sperms are good, they are taken out and they are subjected to the process of ICSI, like I told you. So those sperms, like if we get 4 or 5 eggs from the female in that case, and we get 4 or 5 sperms, 5 good sperms from the husband, then they can undergo ICSI process and they can conceive through their own sperms. So Neelam, if you have a problem like that, you can reach out to us. Yes, there is definitely chance of getting a natural conception done. So you can come to us, we'll get the tests done, and if the hormone levels are normal in your husband, we can obviously go for the process of IVF along with TISA. So that is a very much way of getting. Natural conception will be difficult. Natural conception will definitely be difficult because only egg cannot give you a pregnancy. You need a healthy sperm there. So if you want to go for natural process, then yes, IUI with donor sperm can be that option can be given to you. And but if the parameters are fine, if the hormonal levels are fine, yes, with TISA you can conceive your own husband's sperm. That is a very much possibility.
Thank you, doctor. Doctor, there's one more question that is about. That's from Dimple, ma'am. She's asking. I have less egg reserve. What is the best for me, IUI or IVF?
See, Dimple, we have to first see that when the egg reserve is less, it has to be documented how less. Okay, and what is your age? That is also very important. Age and reserve. In that case, I always counsel my patients, whether this is good or that is good. That all depends upon if you have good reserve as in if you have good number of eggs and your image is good, you can try 3 to 4 cycles or 5 cycles of IUI. That is very much okay. But if your reserve is low, you have to preserve your eggs because you have to look for a procedure where the chances of getting conception are more. So obviously that is more in case of IVF because the success rate today with all the available armamentarians, it goes somewhere around 50 to 60%, more somewhere in 70% also. So you should go for a procedure which gives you a better chance of getting a conception if you have a low egg reserve. And your age is also to be taken into consideration because lesser egg reserve at a younger age, like if you are 27, 28 and you have a reserve of 1.2, yes, I will give you some time. Your AFC is good, I will give you some time. But yes, if your age is around 36 years, 37 years and your reserve is 1.2, I will definitely ask you to go for lesser number of either directly for IVF, or you can go for maximum of 1 or 2 cycles of IUI to try. This will be my stand.
Perfect. Thank you so much, doctor. Doctor, there are no more questions from the audience, but I have a question myself.
Yes, please.
From the point of view of a young male, what are the things that we should consider when it comes to fertility? Because it's also about a lot of detail that is out there about these procedures, but there's not a lot of information for young men to understand about fertility. Can you give us probably a tip or something that we should know about?
Yeah, the fertility issue is rising like anything these days, and we are worried what will happen to the coming generation in the next 15 to 20 years because we have seen increased rates of everything is getting adulterated these days. And the effect directly comes on the reproductive potential of any female as well as the males. Plus, all the consumption of all the substances like the banned substances, the drugs, alcohol, smoking, tobacco, everything is going to negatively impact your fertility. So the for the younger ones, I would definitely like to guide them, to tell them that if there is any if you have any of these habits into you, you please get your fertility checked, get your semen analysis done at least once when you're planning to get married, so that you get to know the right status, what is the right status of your fertility potential, so that you can take the steps at the right time. This is very important from from this present context.
Thank you, doctor. There's one more question from the audience, so that's a little bit more specific. So it's talking about a person who's O positive and got married in December 2021. The baby was
Mhm.
miscarried, unfortunately, in the 6 weeks of pregnancy. Since then, there have been no further pregnancies, and after the miscarriage, they're having pain in the lower right of the abdomen during intercourse. So, doctor, anything that they should consider?
So you're talking, Mr. Bijoy, you're talking about I'm having pain on the lower right side of my abdomen during the intercourse. This is your wife's problem, or this is your problem? That is important. Bijoy seems a male only.
Yes, doctor.
Yeah, because if it is a wife's problem, then we have to go and get an ultrasound done as to where the problem is, because she may have some kind of cyst or something, some endometriosis or endometrium may be there, which is giving her pain. The pain is consistent or it is during only intercourse, so that is important to understand. Whether it is an endometriosis thing, then she will be having painful intercourse. And if it is, yeah, he has answered it's a wife's problem. Yes, so I think Mr. Bijoy, you should go for an ultrasound and see whether she has any affliction of endometriosis or any kind of cyst is there or any other pathology. If it is not there, then she may have some kind of infection which may be giving rise to this pain. So mild painkillers may give, and antibiotic course may also give. But first of all, I need to see the ultrasound to comment upon this.
Doctor, there are no more questions from the audience right now. Bijoy says TVS report normal.
TVS report is normal. Okay, in that case, it could be there. It could be there that something which is there, which is not, which is bothering her. We have to check it completely. We have to go for a local examination if you wish. If you are there in Delhi or in somewhere, we can, you can have a look at the female. You can ask her to come and visit us. We can have a PS examination and look for any local pathology that can also be there. I think we
Thank you,
have.
doctor. I
I
don't
think
think
we
there
have
are any more
answered so many
questions.
questions. The questions are the thank you advances for asking all these questions. I think we have taken care of almost all the aspects of IVF, IUI, or ICSI. If you have any more queries, you can reach out to us. You can ask us. You can ask us about any further specific topic you want to know about. Then we can always have those things into our this the whole series we are going from Apollo Fertility, and many people can be benefited from that. Thank you so much, Sean.
Thank you, doctor. It was a pleasure listening to you. It's a pleasure learning so much from you. I have to say, I really appreciate the amount of information that you have given us. I really appreciate the amount of knowledge that you helped us with today, because understanding fertility is honestly really necessary, and it is one of the things I feel a lot of young people should do. So, doctor, thank you so much for
Yeah.
this information, and hope to have more sessions like this in the future.
Thank you. Thank you so much.
Everyone, we are ending the session for now, unless anybody has any questions. If so, do contact us at Apollo Fertility, and we'll be there to guide and help you. Signing out.